How does ableism show up in healthcare? Have you ever thought about how ableism affects healthcare, especially for those with autism spectrum disorder? It is a topic that deserves our attention. Ableism in healthcare means discrimination or bias against people with disabilities, including autistic individuals. This bias can significantly impact the quality and accessibility of medical care they receive. At the personal level, ableism often shows up when healthcare providers make assumptions that undervalue or misunderstand autistic patients. For instance, some clinicians may rely too much on their first impressions. They might skip necessary diagnostic tests or alternative explanations, leading to misdiagnosis or inadequate care. Additionally, they may overlook social and environmental factors that influence the health of autistic individuals. The language used by providers can also be problematic. Sometimes, microaggressions or insensitive comments can undermine a patient's experience and identity. On an institutional level, ableism is woven into healthcare policies and practices that create barriers for autistic patients. For example, the process for requesting reasonable accommodations can be complicated. This includes communication supports like sign language interpreters or sensory-friendly environments. Medical rationing policies can also unintentionally discriminate against people with disabilities. Furthermore, healthcare materials and communication often lack accessibility or cultural appropriateness for neurodivergent individuals. Structurally, ableism is reinforced by broader social and systemic factors that limit access to equitable healthcare for autistic people. A lack of provider training on neurodiversity and disability awareness is a significant issue. There is often insufficient inclusion of disability perspectives in medical education. Healthcare systems may prioritize normative functioning over diverse neurological experiences, which can further marginalize autistic individuals. From the perspective of autism and neurodiversity, ableism in healthcare reflects a failure to recognize and respect autistic ways of being as valid and valuable. This often results in healthcare environments that do not accommodate sensory sensitivities, communication differences, or the need for flexibility in routines. Autistic individuals may face skepticism about their symptoms or health concerns, leading to poorer health outcomes. To address ableism in healthcare, practical approaches are necessary. Training healthcare providers to understand neurodiversity and the specific needs of autistic patients is essential. Clear policies for reasonable accommodations and accessible communication should be implemented. Providers should also reflect on their biases and seek second opinions or specialist referrals when necessary. Designing healthcare environments that reduce sensory overload can help support autistic patients' comfort. Lastly, including autistic voices in healthcare planning and education can ensure services meet their needs. Overall, tackling ableism in healthcare requires both systemic change and individual awareness. By creating a more inclusive and respectful system, we can better support the health and well-being of autistic individuals.